Now, Bismillah Rahman Rahim, I am going to discuss the another injury which is produced by hard and blunt substances. If you remember that last time I have discussed the abrasion, because I first of all I have to discuss the blunt force trauma, and you know about the fatal outcome which is produced by blunt force trauma is in the form of abrasion, bruise, laceration, and fracture. So if you remember that I last time completed my lecture by completing the abrasion, and today I would like to discuss the another injury produced by the blunt force trauma, that is hard and blunt substances in the form of the bruise. Now the definition of the bruise is that this is the mechanical injury which is produced by application of hard and blunt substances, resulting to the rupture of the underlying vessels, leading to extravasation of the blood under the surface of the skin without solution in the continuity of the skin. Because a bruise is a callous type of injury, you see that when I discuss the anatomical classification of injuries, I place the callous injury and the open injury. So this is one of the callous injury. This is produced by application of hard and blunt substances, resulting to the rupture of underlying vessel, leading to extravasation of the blood and under the surface of skin and without solution or without break in the anatomical continuity of skin. Simply we call it as the bruise. When this swelling occur externally, we label as a bruise, but when it involve the internal structure, we label as a word contusion. So contusion and bruise is one and the same thing, synonymous terminology, but it depending upon the area which is involved. You see in this picture, this is a big bruise, this a blackish eye which is present around the eye. This is a callous injury. There is no any break in the continuity of the skin. However, the extravasation of the blood took places in the loose areolar tissue and leading to the swelling of the part. What is the mechanism regarding the bruise? Very simple. In this case, there is only compression forces to be applied. You see in this picture, now this is the skin composed of three layers: epidermis, dermis, and subcutaneous tissue. Now the bruise produced with depending upon the layer of skin involved, because when we are going to discuss the classification of bruise, it will be depending upon which layer of skin is to be involved and where the collection of blood took place. So what I am trying to say, when application of the force, mechanical force applied in perpendicular position, usually it will be depending upon, there are many predisposing factors which depend upon the formation of bruise. One is the weapon, and other is the force, whether the variety of force is similar force or more force, and the velocity of the force and affected tissue and the part involved. Now look here, if you apply any hard and blunt substances in a similar force is applied, not with force, then it may involve the dermis, may be involved in epidermis. But when it is applied with a maximum force, the extravasation of the blood may can occur under the surface of subcutaneous tissue and leading to the swelling formation. So this is the actually due to the application of more force by hard and blunt substances, external layer of the skin becomes intact. There is no any break in the continuity of the skin, as you see in this picture. This is a blackish eye. This is not actually the site of impact. The site of impact is over this area, vertex area, because in a standing position, when any striking of object applies over vertex, blood start to trickle down due to gravity and start accumulating around the eyes. And this is commonly seen, you see it in case of road traffic accidents or other individual who sustain the injuries on the head area. They've got no bruise formation on scalp area, but usually due to the trickling of the blood from the upper area due to gravity let to settle down around the loose areolar tissue. The face has got loose areolar tissue, around the eyes has got loose areolar tissue. So most probably the blood accumulated, extravasation of blood occur in this area. So similarly, I talk about here, when the force is applied that go beyond the dermis and epidermis, obviously The superficial capillaries venules they start breaking down and extravasation of blood took place under the surface of the subcutaneous tissue because it will be a kind depending upon the layer. Now, due to rupture of the extravasation of rupture of vessel leading extravasation and collection of the blood in subcutaneous tissue, immediately leading to swelling of the part and inflammation as well as the pain. Patient is complaining of the pain. So obviously, this is very easy mechanism. Application of force resulting crushing of the tissues internally and crushing of the vessel leading to extravasation of the blood and leading to the bruise formation. Now let us see the occurrence, causes, appearance, and characteristic features. Now, the occurrences of the bruises most commonly occurs in some cases very early, and in cases, some cases it occurs very late. Occurrences is usually depending upon the force of the impact. If the force of impact is more, it occurs early, as well as if the force of impact is very similar, then occurrence is very late. And causes is usually the hard and blunt substances, where all the categories of the weapons, including hard blunt substances, lathi, iron rod, stone, brick falling down on the ground, table, or otherwise, which is irregular structure, these are the causative agent for causing the bruise. But occurrences may appear early in certain conditions. So suppose a person suffer from the nutritional deficiencies, like as the scurvy, they tend to the bruise appear early. But if the person suffer from hemorrhagic disorder, suppose a person is already patient of hemorrhagic disorder, like as the anemia, like as the leukemia, like as the atherosclerotic changes in the vessels, atherosclerosis, or the abuse of alcohol-induced person, fatty females, or otherwise, in this condition, occurrences occurs very rapidly. But a loose irregular tissue where there is similar loose irregular tissue, the bruise occurs very late. Now let us see come its appearances. I just talk about the appears very readily. Superficial bruises. There are many type of bruises. I will discuss the classification of bruises, but the appearances appears superficial bruise appear very early, but the deep bruise tend to appear after 2 to 3 days because it is quite impossible to see clinically the deep bruises. Suppose a person is applying a lathi or any part of the body. Now, when the extravasation of the blood occurs under the surface of dermis, we called as the epidermal bruise, where swelling appears is early. But if it is the extravasation of blood go beyond the dermis, then there is subcutaneous tissue because we have got layers. Epidermal layer involved leading to abrasion. When dermis involved, may sometime leading to the abrasion. But when bruise is applied, force is applied, bruise can maybe accumulation of blood can occur in the dermis. We called as the epidermal bruise. So similarly appears early, but subcutaneous tissue accumulation, extravasation of blood occurs in subcutaneous tissue, then appearances will be early, easily seenable by naked eye because there is a swelling, extravasation of the blood leading to swelling, discolored area, pain, swelling, inflammation. So we can easily see in appearances can occur in superficial. Deep bruises, for example, if the force is applied with a maximum velocity on the abdominal area externally, I talked many times in my previous classes that the abdominal muscle are flexible, they resist the tissue because due to their elasticity and plasticity, so they recoil and bruise does not form. But the force may transfer again on inside the abdominal viscera can lead contusion in these areas, and we call it as a contusion. But except abdominal area, but the same force is applied on in other areas in muscular area, like his thighs, like his calf area, like his in the arms. The deep bruise can be developed, which cannot be easily seen early, but took some time to be appear because deep bruise cannot be visualized within a few hours. It took some more time. So far, if you want to confirm the deep bruise can be confirmed by infrared photography. This is a technique we apply over the rays has been passed on such area to see whether bruise is present or otherwise. So appearance early in some cases, and it's a late cases can appear. In some cases, it appear very late. What are the characteristic features of the bruise? You see there is the extravasation of blood in due to striking a hard blood substances leading to swelling, inflammation, pain, and this can be varies from smaller size to larger size. And if you have seen a last slide, there is a you see the this slide again. Now you see this slide again. Now this is a big bruise around the eyes. This is the actually the hematoma. When excess accumulation of blood under surface of the skin occur, we sometimes label as the hematoma because it's also called as the black eye. And this is another term is a label for this condition is the spectacle hematoma. Usually words used refer for spectacle hematoma. It is the another type of bruise because here extravasation of blood is more than the normal size of the bruise. So bruise maybe varies from pinheaded to larger size where we when it is more elevated above the surface of the skin we call it as the hematoma. Now this is the characteristic features. Then I am coming on the various types of the bruise. Likewise, if you remember the last time I discussed the type of the abrasion where I put the type of different pattern abrasion. Similarly, we have got pattern bruise. Now this is produced by some hard and blunt substance, some patent object. Now you see when patent object is inflicted with a force. Now I talk about the various predisposing factors needed for production of the bruise. One is the force, another is velocity, another is the part affected. And number fourth is the rigidity of the weapon. Now if you take in a rubber and if you apply, the rubber is not more rigid. If you apply lathi, it is more rigid. If you apply iron rod, it is more rigid than lathi. So I say here that patent object, when it is applied, now they lead to extravasation of the blood under the surface of the dermis. We call this patent bruise is also called as the intradermal. Now you see multiple intradermal bruises are seen on the back of the chest area, where the pattern of the injury is simulating with the object applied. So the pattern object when applied with maximum force on any part of the body, extravasation of the blood seen under the surface of the epidermis. Dermis does go beyond the dermis because subcutaneous tissues lost other than the epidermis. So only the blood appears in the intradermal. So this is also called as the intradermal bruise, externally very visible. You see the visible. Now the pattern of this injury is simulating with the patent object because this can indicating which type of weapon is to be applied to produce the bruise. So these type of the which the example is the whip lashes, rubber tube, tire mark when they are applying over the body or passing over the body. The only extravasation of the blood took places under the surface of the dermis leading to intradermal bruise. Then you see the second type is the superficial bruise. I talked just a minute. Superficial bruise is also called as the subcutaneous bruise. I talk about that the bruise is produced by layer, starting from dermis, subcutaneous tissue, deep to the muscle, and then involving the viscera. So second type of the bruise is the superficial bruise. We can call it as the subcutaneous bruise. What happens? Due to the application of hard and blunt substances, now extravasation of the blood on account of the rupturing of the vessels tend to appear under the surface of the subcutaneous tissue. And you know about the layer. I show you the picture and the mechanism that behind the below the dermis there is subcutaneous tissue. This layer extravasation of blood now appears under the surface of the subcutaneous tissue, but the external continuity of skin is normal. You see in this case, the arm, there is a superficial bruise. This is the subcutaneous accumulation of the extravasation of the blood without break in the continuity of the skin. Such type of bruises is a superficial, can be seen easily with the naked eye, appear early, and they are slightly, their edges are blurred, slightly elevated from the surface of the area. You see the slightly elevated area because this is a swelling, the area has to be slightly elevated. Again, you see here, now this is a discolored area. Now this slightly elevated above the surface of the skin, may ranging from pinheaded to the larger bruises, depending upon the type of the weapon, depending upon the force applied, and depending on the part struck. Then third type of the bruise is we have got the uh, deep bruise. Now I talk just a minute. The third category of bruise is the deep bruise. Usually such type of bruise is inflicted by maximum force when it is go beyond through the soft tissue. Bruise can appear deeply, cannot be externally visible. It took more time to be appear. And similarly, suppose a case comes to you, you have got only the history of striking some object on certain area. You have got externally no visible injury, but he complaining of the pain and swelling on that area. So might be this is the deep bruise. Took some time to be appear. And I say here that for this analysis, deep bruises, we should have to be wait for such cases when referred to hospital for complaining of pain and swell, striking of object on certain area. Externally, it is not visible because extravasation of blood is go beyond subcutaneous tissue. It is depending upon the layer involved. So now deep tissue involved, the muscular area made involve the organs, so it took more time to be appear. So for this reason, we want to raise at least wait for about a few 1 or 2 days to take appear on the surface of the skin. For this reason, if you want to analyze the deep bruise, then we do the infrared photography. This is the technique by which the rays has been passed from such area and can be located, can be examined that extravasation of the blood is always present under the below beyond the subcutaneous tissue, and deep bruise can be realized with the passage of time. Number fourth is the D. You see six penny bruise. Now this is the type of bruise which is a discoid shape, 1 centimeter in diameter. Now, six penny bruise is a technical name given to the type of bruise, especially seen in case of throttling. You see this picture. Now, this picture is a neck is to be exposed where neck is to be compressed by means of a hand. And you see this is the bruise, pressure bruise. Last time I talked about also the abrasion. And I also showed the same slide previously where I talk about the abrasion, crescenting abrasion, because the tip of the finger has got two areas. One is the pulp. When pulp is pressed against the force with the neck area or certain area, due to pressure, the pulp leading to pressure bruising. Whereas a nail, when it goes inside the skin, leading to the crescenting abrasion. So this is a discoid shaped. Discoid shaped have size about 1 centimeter in diameter, and usually seen in case of the throttling. We call it as the six-penny bruise. Then last category of the bruise is the tram line contusion or tram track line contusion. You see this picture, first of all, this is the multiple linear type of the bruise. Again, another linear type of the bruise. Now the name label is a tram line contusion or tram track. When the tram is when the just like our railroading, just when rail is going on their patries, if you see here that it has got just the same pattern parallel. These are two parallel pattern of the tram like abrasion, tram track contusion, railroad abrasion contusion, or tram line contusion, one and the same thing, because here there is a two parallel lines running across the skin on the area. You see discolored area. These are the two multiple abrasions produced by a linear object like a stick, produced by a whip, produced by iron rod. Now the produce a multiple, the two type of the abrasion, which looks to be a railroading type. We call as the tram line. What is the mechanism lying here? You see, whenever the stick is to be applied, for example, if you have got a very thin stick or any small iron bar in your hand, and if you strike or any elastic, a flexible structure like whip, you apply over the skin. Now, when it is applied on this area, and in second attempt, it applied on this area, so the blood can be displaced around from this. This is the empty area. Now, the blood can be displaced due to the force applied here and force applied here. Now the blood displaced from this area, and blood can be displaced from this area, accumulated in this area, leading to rednessing of the area. And these lines shows the pattern object which is applied on this area, give impression, pattern of injury, parallel lines, which looks to be a tram-like appearances, tram track-like appearances because of displace of the blood due to the force applies on the skin. So this blood is displaced on either side, discolored area. This is one number. Another line we call is the tram-like continuum. Let us see the factors modifying the appearance of the bruise. There are certain factors which modify the appearance of the bruise. Number one is the site of injury or site of the impact. First, you remember in your mind, there are certain bruises which appear at the site of impact. There are certain bruises which appear away from the site of the impact due to the gravity. Now, just I will discuss that how I say that it appears at the site of impact, how it appears away from site of impact. So site of injury is more important if it is applied in certain area where a bruise does not easily appear. For example, if you take lathi and apply over the head area, scalp area, site of impact is the scalp. Now it is bruise does not readily appear because the skin can be compressed between two hard object. Number one is externally you are applying the lathi, and internally hard structure is the skull. So skin is ruptured under the between two hard objects, so lead in spite of developing the bruise, it leading to laceration. But if the same below is applied instead of this on other area where the more lax tissue like face area, like around the eyes, then the bruise tend to be appear. So site of impact is more important. If same force is applied over shin of the tibia where intervention of the tissues are not more subcutaneous tissues absent, only skin, and then is a shin of the tibia, here the bruise is less commonly produced. The skin will be ruptured because underlying structure is the tibia and overlying structure is the hard blood substances. So in spite of extra visition of blood in subcutaneous tissue, the skin is split down, leading to wound formation. But similarly, you apply on other part of the body where the underlying structure is not bone, then the bruise tend to be appear very early. Similarly, it is less commonly appear over the palms and sole because the dermis of the palms are very thick enough, as well as the dermis of the sole, they are very thick enough. So if you strike any hard blend substances on the palms and soles, the bruises less commonly appear. But same force is applied on other part of the body, bruise can be appeared. But if it is applied on the skull, there it is impossible. The bruise cannot be appear on the skull due to compression of the tissue, skull between the lathi and the skull, leading to lacerated bone. Number two, vascularity of the part. This is general rule. More vascular the part, then more bruise will be produced. And just I quoted example. If you see the more vascularity, more bruise form, less vascularity of the part or tissue, the bruise tend to appear less. For example, if I say the below eyelid, lower eyelid, the tissue is way more vascular. Now is lessly supported by the capillaries and venules. So the extravasation of the blood can appears early as soon as possible. If it is a strike on the forehead, if it is a strike on the head area, blood tend to accumulate onto the extravasation of blood appear under the surface of the tissue around the eyes, around the face, and the rest of the other part. But if they're not more vascular, bruise less let to be appear not early. Third factor is the age of the victim. Now, if I talked last time that there are certain predisposing factors which modify the appearance of the bruise. Now, in children's and old ages, the bruise tend to appear readily and less commonly in case of the adult and otherwise. Now, why? Because in the children's, because of the delicacy of the skin is still not tight enough. And whereas in case of the old ages, because of the loss of elasticity and wrinkling, you see wrinkling of the face area, wrinkling of the hands, wrinkling of the other portion of the skin can usually be seen in old ages. So old ages people due to loss of elasticity and due to loss of delicacy. In case of children, they tend to bruise appear early in this age group. But in case of the younger age group, it is maybe depending upon the force, whether force is maximum, then appear early. If it is maximum minor, then it appears lately, very slowly. Then we have got gender differentiation, that is the sex. Now, if you see here that I talk about, the females are very prone to tend to develop the bruise early on account of more subcutaneous tissue, fatty area. So in case of female, it is more common. They tend to develop bruise early on simple strike. But if same below is applied over the other adults, now it is less commonly in case of the male. So female predisposing factor for developing of the bruise in the females is also common on account of the more subcutaneous tissue. Color of the skin. Now, the presence of the bruise is more readily be seen in fair skin persons, but if you have got a black skin, you cannot be easily recognized by naked eye examination the possibility of formation of the bruise due to the dim color or due to faint skin color, black color. We cannot easily justify the developing of the bruise, but in the fair color, pupils, the bruise can easily be recognized with a naked eye examination. Then number 6 is the natural diseases. I talk in initial talking. There are certain diseases where developing of the bruise is very early, especially the nutritional deficiency. If suppose a person suffer from scurvy, if suppose person suffer from hemorrhagic disorders like anemia, leukemia, hemophilia, blood discresis diseases, atherosclerotic changes, alcohol-induced personces, and obese people. Now, these are tend to lead to develop the bruise early on account of the loss of the vitamin C inside the tissues. So they can lead to develop the bruise very early as comparing to normal cases. Number 7 is the gravity shift of the bruise. I talk about this. There are the certain bruises which appear away from the site of the impact. We call it as the gravity shift. Suppose the striking as one area and bruise may develop on another area. This we can call as the shifting of the bruise due to gravity. This is called as the gravity shift of the bruise. Let us see an example. Suppose I quoted example of the striking of an hardened substances over vertex area, leading to trickling of the blood due to gravity in a standing position to get accumulated around the eyes, and especially seen in case of the RTA, in case of the trauma sustained on the head injuries. Usually cases of head injuries, you see the person who coming in the cavity have got both eyes black. We call it the black eyes due to the gravity shift of the bruise. Striking was on the vertex area. He has got some strike over this area, and blood can tend to trickle down from upper area to lower area, get accumulated on the loose area, around the loose area tissue in lower part of the face area and around the eyes, because bruise cannot be easily appear over the scalp as I talk about. Number 2, if you apply any striker below over the forehead or over orbit, now due to the gravity, the blood can shift it down. If it is striking over the, or listen me again, when if it is striking appear on forehead, if you apply any hard blood substance in forehead or over orbit, or fall on vertex, then the trickling of the blood get accumulated behind the ear. So swelling will be seen behind the ear, or there will be fracture and bruising seen around the foramen magnum. What is this? This is nothing but striking was over the orbit, and it is the shifting of the blood from the orbital area to go get accumulated behind the ear, which we can call as the battle sign. And battle sign is the significant picture that striking was not behind the ear, but striking obviously was striking on the forehead or on the orbital area. Similarly, taken another example. Well, if a person has got fracture of the femur, suppose he has got fracture of head of femur. Now you see that the outer side, the lateral aspect of the upper part of the thigh is bulged down due to the trickling of the blood from the acetabulum cavity and get accumulated on lateral side of the thigh. What is this? This is the gravity shift of the bruise. Striking was on the acetabulum cavity where the fracture of neck of femur took place, but due to gravity, blood shifted down from this area and get accumulated in the form of swelling on lateral side of the leg area. Similarly, if it is striking on the lower thigh area, then in standing position, blood cannot be accumulated on that area, but get accumulated around the knee joint, and the person has got swelling around the knee joint. What is this? This is the gravity shift of the bruise. Striking was on upper area, but blood can trickle down lowerly and accumulated over the knee joint. But if I same below is applied with force on calf muscle in a standing position, blood cannot get accumulated in bruising. It does not appear on that area, but blood trickle down to accumulated around the ankle joint. So because of the gravity shift, now bruise can be appeared, and blood shifting of the blood due to gravity can occur on the depending upon the gravity. This condition is called as the gravity shift of the bruise. Now, what is the differential diagnosis of the bruise? What are the DD? What are the confusing conditions which are simulating with the bruise? There are so many conditions which are simulating the bruise. If I take an example from, is if you remember that I talk about that the superficial bruises, they start from smaller size to larger size up to hematoma. When it is smaller size, we say smaller bruise. When we it larger in the form of gush of the blood accumulated, as you see in around the eye, we label as hematoma. Hematoma is a form of the bruise, but the extravasation of the blood is more as compared to usual bruise. So what is the differential diagnosis which are simulating the bruise? Try to understanding me, please. Number one is the achymosis. Achymosis is a pathological condition in which the extravasation of the blood are very small spot of the blood can appear on the surface of the area. Now, tissue show faint, discolored or spots in the tissue. We call it as the achymosis or congestion. Second condition is the critical hemorrhages. You see, these are the eye. This is the reddish eye. You see the reddish eye. Now, conjunctiva show spotting of the bleeding. Again, you see this loose areolar tissue containing the reddening area. Now, this is called as the petechial hemorrhages, or so we are also called the Tardou's spots. Now, Tardou's spots usually develop most probably in asphyxia and asphyxial death. Now, suppose one can construct the neck by hand. Now, person try to breathe on account of increasing intercapillary pressure due to pressing of the neck area. Suppose you are gripping the neck by your hand, victim try to inhale the exchanging of the gases, and you try to compressing the neck. In this relevant method, there is a intravascular pressure will be increasing down, and it lead to rupture of smaller capillaries, especially of the face area, because the lower part of face area contain many capillaries, superficial capillaries, which tend to be ruptured and give rise to pin-headed type of appearances, especially in conjunctiva, whitish area, that is sclera, and in the lower part of the face in the form of a smaller pinhead, which we can call as the Tardou's spots or petechial hemorrhages. So one was the achymosis. One is differential diagnosis is the petechial hemorrhage, where the person can say either he sustained any trauma on this area, so he has got reddening eye. Is he suffer from any trauma on lower part of the eye, so containing the reddening area, but nothing. These are the Tardou's spot, which are sometimes simulating with a similar type of the bruise. Number third is the purpural spot. Purpural disease, they have got purpural spot on the skin, which are simulating with the bruise, but they are not bruise, but it is due to the platelet disorders leading to purpural spots. And another is the hematoma, as I showed you last time. Hematoma is coming in the differential diagnosis of the bruise, because it extra visition of blood is more as compared to normal bruise. And when you start cutting the area by a knife, you take a knife, and if you start cutting the hematoma, large gush of the blood accumulated in localized tissue may be effused down from the cutting area. We call this the hematoma. And most important differential diagnosis of the bruise is the postmortem lividity. Now, you see here the postmortem. Try to understand what I'm trying about the postmortem lividity. First, try to understand postmortem lividity, postmortem staining, hypostasis, verbicis, sugillation, These are the different name given to the postmortem lividity. This is actually the postmortem phenomena. What happens after death? Try to understand me. What I'm saying about the postmortem lividity, which come under the differential diagnosis of the bruise. Now, postmortem lividity, actually, what happens after death when person dies away. Normally, you have seen that when a person after natural death or not non-natural death, person dies away. Now, slowly and gradually, by natural way, the changes occur in the body. Now, changes which occur in the body after death and classified into three groups. One is the spontaneous changes, second is the early changes, and number third is the late changes. Now, I just quoting a very simple example of the changes which occur in the eyes, the changes which occur in the skin, changes which occur in the temperature of the body. You see the body start losing the temperature after death and body start cooling. We call this the cooling of the body. So these are the changes basically coming after death. Normally, there is no cooling because there the hypothalamus regulating the body temperature. But when the body dies away, person dies away, basal metabolic rate sees down, all the system start seizing down, body start losing the temperature. And you have seen that when you are putting your hand on dead body, body is cold and clammy. Now, similarly, the early changes which occur, immediate changes which occur in the eye and other, I'm not talking about, but try to make you sure and understanding regarding the postmortem lividity, that the another change which occur in the muscle and the skin is the postmortem lividity. Now, postmortem lividity is another change which occur naturally after death. Suppose the person is lying in a supine position, now face facing upward. Now, this is the back side of the body. Now, what are the portion which are resting over the ground? These are the blades of the shoulders. Now, you see this area and the back of the chest area, buttocks, and the calf muscle and heel. They are resting. Normally, when we are sleeping, any supine position, these are the area which are contact with the bed or ground. Let us see now here. Person dies away. Now he's in a supine position. Now what happens with the passage of time after 6 to 12, after 4 to 6 hours, the blood, because it becomes fluid down, because the blood loses its viscosity, and after death the blood becomes fluid down, so it start to be trickled down from the upper area and let to settle down on depending area. Now these are the depending area because these are resting on the body. Now the portion which is compressed, so this is the contact flattening. You see, when portion which is facing against the ground, there is becomes fillet down. So this is the contact flattening, because after death the muscle loses tone. So toneless muscle, it becomes start flattening, and the blood which is fluid in consistency may come from upper area and tend to settle down around the shoulders of the blade of shoulder or in the buttocks. And you see in best seen in the next slide. You see in this, again this slide, you see this discolored area. Now this is the contact flattening. Again, the backside, you see in this slide, contact flattening, and around the contact flattening, there is a discolored reddish area, which we can call as the postmortem nudity. Because when you turn the body, there is a contact flattening area. This area is resting on the ground, and the portion which is free, now the toneless capillaries retain the fluid blood, which is trickled down from upper area of the body and get accumulated on this area, on back of the chest area, as well as on buttock area, make confusing us whether it is a postmortem lividity, whether it is striking some object, it is in the form of bruise. But actually it is not a bruise, but it is a postmortem lividity, which sometimes confusing, may be simulating with the bruise, which comes under the differential diagnosis of the bruise. And so far, so as to for confirmation of bruise and postmortem lividity, very simple technique is that you take knife, we call it as the incision test. When you start cutting the skin on this area, if the extravasation of the blood is outer the tissue, in case of bruise, then blood can start oozing. But if the postmortem lividity, the blood is trickled down, get accumulated in tonus capillaries and venules. So it is not in the tissues, but it is settled down inside the vessels, that is the toneless capillaries and venules, which give a discolored area, on this area, which simulating the postmortem bruise, but it is nothing, but it is a postmortem lividity. These are the differential diagnosis of the postmortem, that is bruise. Next heading is the age of the bruise. How will you estimate the age of the bruise? Okay. Huh? Age of the bruise is identified on the basis of the color changes which occur in the passage of time, because extravasation of the blood took places, and on account of hemolysis of RBC. When RBC is hemolysis, hemoglobin coming in the tissues, and the pigments which is available in the hemoglobin comes in across in the tissue with the passage of the time and give different colors. So by reading the colors of the area, we can estimate the age of the bruise. Initially, the bruise is with a fresh bruise is red in color. You see in this picture. But when deoxygenated blood coming in the tissue, it is just a purple in color or the bluish in color, which is in about 1 to 3 hours. And after 1 to 3 hours, in 4 hours, the first pigmented from hemoglobin is released down, which is we can call it as a hemosiderin. And the hemosiderin gives a brownish blue color. Hemosiderin releasing within 4 hours give the brownish blue color, and after 5 to 6 hours, now the hematidin is to be released, which gives in a color the green color. So green color comes in within 5 to 6 hours, and after last pigment, hematidin, hematidin, and the bilirubin released from the broken pieces of the areas of the hemoglobin give a yellow color and appears in 7 to 12 days due to accumulation of the bilirubin in the tissue. Color of the bruise will be yellow, and the normal skin will be within 12 to 15 days, skin becomes normal. So by reading the colors with the passage of the time, we can estimate the age of the bruise. Now you see here the picture. This is a fresh bruise, just a reddish type of color. Now then deoxygenated bluish color of the bruise portion is to be exposed here. Now it color into this bluish color can be changes into the brownish blue color, which is this comes into 1 to 3 hours. This is a fresh. This comes into the 5 to 6 hours, and this comes into comes into 4 days. This comes fresh. This comes 1 to 3 days. This comes into 4 days. This comes into 5 to 6 days, and green color and yellow color obviously come to 7 to 12 days. Time is over. I would like to stop here. If any question, I will continue this bruise again in my next class. Any question, please?
Sir, can you please repeat the six-penny bruise?
Speak loudly.
Six-penny bruise, sir. Can you please repeat that?
Which type?
Six-penny bruise.
Six-penny bruise. Now this is just discolored appearances when we use hand. Now we have got a pulp of the fingers when it goes in throttling. Suppose you are gripping the neck area. Suppose you are gripping the baby with your hand on forearm. When you are gripping anybody on upper arm, now due to the pressure of the tip of the fingers, they give a discoid 1 centimeter size of the pressure bruising. We call it as the six-penny bruise. Next question, please.
Sir?
Yes.
Sir, can you please repeat the differential diagnosis of ecchymosis and Tardos sport?
Yes, of course. Now this ecchymosis is a pathological condition. This is due to the congestion or extravasation due to any pathological lesion in the tissues. In size is very smaller, below 1 centimeter, and obviously they is even below the pin-headed appearances. We called as the ecchymosis pathological condition due to any pathology in the tissue. But the Tardos spots is called as the petechial hemorrhages, and petechial hemorrhages is occurs due to pressure. Suppose you are gripping the neck, आपने neck को पकड़ा, for example, you giving the causing throttling. Now person tried to breathing, when he tried to inhale inside and then exhale outside, this phenomena lead increasing intercapillary and intravascular pressure. On account of struggle of the victim, when you are gripping the neck, throttling, your hand is in the neck, you are gripping the neck and you are giving the pressure and medial medial plane to grip the neck anyhow, and person try to escape and he want to take breathing. And during this process, intravascular pressure will be increasing the vessel. On account of increasing intravascular pressure, especially in capillaries venule, they burst down. Now superficial capillaries burst down and give rise a pin-headed appearance of the blood, which called as the tardius spas, especially seen on loose areolar tissue, seen on face area, on the conjunctiva and loose areolar tissue, especially on face area, in case of death due to asphyxia, asphyxial death. Yes, please. Another question. Another question.
Sir, how do we know that these are antemortem bruises or postmortem bruises?
Okay. Now, I missed this slide because antemortem bruise and postmortem bruise, we have got many differentiating points to differentiating the antemortem bruise from the postmortem bruise. Now, let's see this slide, the antemortem bruise and postmortem bruise. Now, antemortem bruise and postmortem, I will discuss later on, but if you have got a question, I'll make an answer. Now, you see the comparative study between antemortem and postmortem bruise. You see, first of all, the swelling of the part is present in antemortem phenomena. Swelling of the part in postmortem phenomena is missing. Extravasation of the blood can usually occur due to rupture of the vessel in antemortem position, and extravasation of the blood cannot be seen in postmortem bruise. Signs of inflammation recent or in antemortem phenomena, you see there is signs of inflammation, swelling and pain may be seen in case of antemortem phenomena, but it is missing in postmortem phenomena. Vital reaction, I talked last time that if we want, we take the tissue piece and we see under microscope for the presence of any possibility of vital reaction, which is a purely sign of antemortem phenomena. And vital reaction, vital reaction means pain, swelling and healing process. We call this the vital reaction, which seen in microscopic study is seen in antemortem phenomena. And after death, if you take tissue will be dead, so vital reaction will be negative. Condition of epithelium, epithelial tissue is subepidermal, epidermal or subcutaneous tissue becomes damaged, ruptured on account of application of force in the antemortem. But if you apply any lathi or dead body, now there is no any epithelium, dermis, epidermis, subcutaneous tissue may be damaged down. So damage will be seen in the tissue in the antemortem phenomena and can missing in the postmortem. Microscopic examination, I talk about microscopic examination. Suspected portion of tissue will be seen to see under microscope for possibility of vital reaction, signs of inflammation, healing, or any other possibility of the blood or tints, which is purely goes in the favor of the antemortem phenomenon. Next question. Any question?
Sir,
Ji, please.
sir,
Okay.
what is the difference between bruise and hematoma?
Okay. Now, actually, the bruise is a hematoma is a kind of a bruise, but it comes whenever smaller accumulation of the blood occurs either subdermal or subcutaneous tissue, because it is depending upon the layer of the skin involved. Size of the bruise is very smaller, but when more extravasation of the blood accumulated around the tissue due to excessive rupture of the bleeding, and the swelling is more, which is raised above the surface of the skin margins are blurred, and massive bleeding can be present, we call as the hematoma. And such hematoma sometimes can lead to complication. That suppose the hematoma produced by any part of the body, sometimes compressing the nerves which are crossing that area and leading to the paralysis on that area. But bruise is very similar in size, we saw called bruise. But when there is excessive massive bleeding on cutting by knife, the gush of the blood available in the tissues we called as the hematoma. But the tanks of the blood, when seen under surface of subcutaneous tissue or subepidermal or dermal, we can call it as the bruise. So hematoma is more accumulation of blood labeled as a hematoma. Next, please.
Sir, can you repeat the effect of age on bruises?
Yes, of course. Now, actually, the age influences the bruise appearance of the bruises, and now it is a general natural rule that the in old ages and in the infant, the bruise tend to appear readily. The reason is that on account of the delicacy, because the skin of the babies and the childrens are very delicate structure, not tough, texture of skin is not tough enough, so it appears early due to delicacy of the skin. And in case of old ages may you see that after 45-year age group, the elasticity and plasticity of the skin start losing down, and the people developing the wrinkling around the eye. This is one of the important sign of the old ages. So due to loss of elasticity and plasticity and wrinkling skin on the areas, that the bruises easily tend to appear on this area in case of old ages. But on account of an adult of tough skin, more tight subcutaneous tissue, epidermal, they are very tight enough. So it tend lead to take more time to be developed. But it appear early in old ages and in children on account of the position of the skin. Next. Another question, please. Hello. Thank you very much.